Great. Well, thank you all so much for taking the time to be with us. We so appreciate your participation. This is my favorite part of my job, getting to ask questions and talk. So it's a good thing they hired me for sales. Let's start in general. Ladies first, if that's okay, Danita. Sure. Okay, great. You'll come through. I know you will. I'm curious, today, healthcare is such a multifaceted industry, right? You have people, surgeons that are making just hundreds of millions of dollars, whatever, down to you have your entry-level jobs, cafeteria workers, things like that. How in the world do we organize employee wellness, employee well-being, employee engagement for a workforce that has all of those different types of people?
I mean, it's definitely a challenge. I will say that we actually are in the midst of a total rewards compensation survey. So we're really excited to get the results of it. A couple of things we're looking for is what do our people value? And that's going to vary depending upon their demographic, their age, their position. So we have ways to be able to digest that information and dissect it down. We want to see if there are inequities with food, money. Where are those challenges with some of those, maybe the lower income positions, or you may see that we may be surprised and see that there's some salary positions that are struggling as well. So really we're putting a lot of money and effort behind that particular aspect. So we're looking forward to that because we really think we know what people want, but do we really? So
yeah, that's so true. I think a theme that we'll probably hear a lot is like, do we actually know what people want? We only know what we don't know, right? Great. Corey, what about you?
Very similar to what Tanita mentioned. It's really understanding what is value and how do we define value, and we can't. We have to go back to our team members, and we have used a new methodology. In fact, I see Ryan out there. Ryan was part of this program at Intermountain. We started using conjoint max differential analysis to really understand, of all the things that make up the employment experience, which ones are most important to you in the context of what brought you here, what keeps you here, and not ultimately what inspires you, what really drives that discretionary effort at the bedside. And we can really pinpoint exactly, of all the things that we can do as an employer, which ones matter the most, which ones really do drive that discretionary effort, and which ones really, I think, are competitive distinctions in the marketplace.
Yeah, that's great. Thank you. JD, anything to add?
Yeah, just a few things to add. Love what's already been said. I believe it's very important for a leader, especially executive leaders, that when they enter a room, they don't treat others differently, per se. They spend just as much time, just as much attention to the housekeeper as they do to the top, even a producing surgeon. And I've had frontline staff mention that to me when I first, was given our surgical services, for example. I asked them, hey, what can I do to really be a good leader? And they said, well, you already do it. When you come, you talk to us. You don't spend your time more with, just because they're a higher revenue producing surgeon, you get to know the person behind the badge. So I think that small, simple principle speaks magnitudes and makes a huge difference.
Yeah, I love that. In studying recognition and culture for the last 4 years, I feel like that concept right there, it's little things done consistently that make such a huge difference in the employee's day-to-day experience. So on that note, talking about the current landscape of recognition, I might just stick with you, JD, if that's okay, to piggyback off this. Talk to me a little bit. Your role has changed just slightly in the last little bit. Yeah. But looking back at your previous organization, what was the current state of recognition? And what were some of the things that you did to implement behaviors or a culture like that?
Yeah, absolutely. So one thing that I learned at actually Intermountain Health was where I did my residency, and then I did my fellowship with HCA Healthcare, Mountain Star. There's a 10-5 rule of when people are in the hallway, you actually recognize them, you see them. And again, that seems something so simple, but it makes a difference. Some of the things that we implemented, and I've learned, are employee rounding, walk in your shoes. So we went from assisting in the OR to helping turn around rooms for our housekeeping staff. And then afterwards, after we spent a day with them in scrubs, we would write them a thank you note. And it was very interesting to me, and often shouldn't have been surprising, but it was how much a handwritten note from an executive leader meant to them.
Well, and kind of a follow-up question, did people ever communicate to you why that was special to them? Or, I mean, think we can all kind of draw our own
Yeah.
conclusions, but what was the feedback you got from the staff?
Yeah, the feedback we received, and it was alluded to earlier, was particularly in healthcare, it's a pretty thankless job, more often than not. And these people have hard lives, and particularly our housekeeping team. These are just salt of the earth people, really, really good people. They work hard. They have oftentimes really hard family lives, and to be seen by somebody that they view as, this big person means the world to them. And I've had some confide in me with those feelings that they have.
Yeah, thank you. That's so sweet. Danita, Corey, I see you guys nodding your heads actively. Danita, talk to me a little bit about the current state of recognition, and talk to me about some of the things you're thinking about.
Yeah, so first we follow the same 5-10 rule, but we also have our eye care values. And some people here may not know much about Houston Methodist, but if you live in the greater Houston area, everyone knows Houston Methodist. You go from one hospital to the next, or one employee to the next, and we all treat each other with the same values. That goes from our housekeeping to our food service, to our chaplains, to our administrative teams. So when I joined Houston Methodist, which was less than a year ago, I was like, well, maybe, we'll see. But then truly, I've seen it live up to its word. So some of the things we're doing, unlike maybe other organizations, across, I think, the country, our tenure is significant. I mean, I had a surgery recently, and I asked every single person that I encountered in the hospital, how long have you been at Houston Methodist? 25 years, 40 years, 35 years, 15 years. I'm going on my 10th. So with that in mind, one of our biggest projects every year that Awardco helps us with is our lunch. We have a recognition lunch, and our CEO, he attends those. The C-suite attends them, your leaders attend them, and your peers attend. And we have a luncheon for, I think it's 5-year, 10-year, 20-year, 25-year. We have some people that are in like 30 and 40 years. So to have that opportunity to recognize people who continue to follow those values and they still enjoy what they do means a lot. So we put a lot into that. And then, we have other programs as well. But I think from an employee perspective, everyone's striving to get to the next level.
Tenure is such a conversation in and of itself, one that I think we should get to a later point in this conversation, but I think we'll talk about like the return on investment, the ROI of recognition. But that to me, as like if I were a patient getting a surgery and my surgeons and my nurse staff was saying like, I've been here for X amount of years, oh, I'm going to return. Like what that speaks of volumes to the care, right? That Houston Methodist.
And they say it with excitement too. It's not like, oh, had I been here forever.
Right.
Yeah,
it's like they're proud, and then that
absolutely
communicates confidence to the people that they're serving. Great, Corey.
Well, we've started down this path years ago. It's around reward and recognition from a cultural perspective, and what we discovered is that rather than catching people doing things incorrectly in coaching, it's catching people doing things right and celebrating that. And we spend a lot of time with something called gratitude grams, this simple concept of how many gratitude grams can you issue as a leader, as a peer, because we definitely emphasize peer-to-peer recognition on a regular basis. And then we've started to do some linear regression studies around what do these gratitude grams mean in terms of retention, in terms of performance, in terms of really driving clinical outcomes. And it's amazing, just as Daryl pointed out, people chasing Gold Star Achievement Awards, this idea that there's a direct correlation between this simple act of saying thank you, and I appreciate what you've done, and it means something to us and our patients. And that goes a long way in terms of achieving clinical outcomes.
I love how much you reference data. I love data. I got my degree in industrial and organizational psychology, and can't believe I got a job where I didn't have to get my doctorates to use it. But I love the concept of being able to actually tangibly put the goodness, like something that's a little bit abstract, like recognition. What does that mean to hardline data points? This is how it helps, and this is how it's affecting the business outcomes. I'm curious, among maybe one of the studies that you did or some of the data points you've analyzed, what was maybe the most shocking to you in increase from the results of your efforts towards employee recognition?
We created an aggregate measure of leadership effectiveness. How do we reward and recognize leaders who get results the right ways? By demonstrating our core values, demonstrating our Thrive principles. And what we've discovered, this is common sense, but when you have data, to your point, behind it, you have more of a fact-based decision science around how we invest in people. And we started looking at leadership effectiveness index achievers in the context of things that are very important to mission sustainability, such as HCAP scores or length of stay or hospital-acquired conditions. And it takes a common sense concept, which is if you're a good leader, you're probably going to get better results, but you can demonstrate it with data, and it's very powerful.
Yeah, I completely agree with you. Which leads me to another point that I'm curious about. One that I hear a lot in my conversations with HR leaders in every industry, but specifically in healthcare, when you have data and you present it to your leaders saying this is something we need to buy into and invest more, it's usually like, oh, okay, there's numbers to back this. What do you do when there aren't numbers just yet, though? I feel like recognition and things along that lines, it takes at least a year to get that kind of tangible data that we preach about. So how have you guys been able to approach leadership teams at any point in your career without data? How do you get leadership buy-in, essentially? And Danita, can I start with you to answer that?
Sure. I'm going to be a little bit more limited, I think, in my answer here since I'm newer to the health system aspect. But I mean, we are conservative in the things we do because you have such a diverse demographic, and you want to make sure that we're applying our budgets to the right things. I mean, we run a $500 million just health insurance program, so that sucks up a lot of money, right? So I think it's really one of the intentions from a benefits perspective, which is our area, is to take this, like the survey data we're getting, so we know where to invest our monies. We also are improving right now. We have a lot going on with our systems. We've had the same internet portal, I kid you not, since like the late 90s. So that's where our budgets are going. Those are no-brainers, right? You don't need a lot of data to tell you it doesn't work any longer. So technology is advanced, we didn't. So it's time to put those dollars into the digital workplace and then Workday as well. So for us right now, that's where we're focusing. So I'm going to defer to these two gentlemen to give you more of the nitty-gritty with meeting those obstacles. So.
Well, I still think it's really important. And you bring up a really good point that like there's at any given moment, everyone in this room knows how many competing priorities that you have. And everyone's going to, every stakeholder is going to come to you with like, no, this is number one. No, this is number one. And so again, healthcare heroes, you in this room have to have that fine-tuned craft of understanding what is actually the most important thing to be focusing on. JD, this might be an interesting question for you given your new consultative role.
Yeah, absolutely. So with my new consultative role, what I've done is shift to what I enjoyed most about being a healthcare executive, and that was helping people and teams become their best selves through culture. And culture meaning ownership, truly owning the experience and wanting to drive results through the company's and individual purposes and missions. So yes, very passionate about culture and how it impacts people, and recognition is a huge part of that. We know that a best practice of change management, because that's basically what we're talking about here, are having different champions, people that can be advocates for what you're trying to instill in a company. And I would say that the biggest the biggest champion that you can have is yourself, and leading by example. If people see that you're leading out front, that you're not only just talking the talk, but you're actually walking the walk, it can create change. And I've seen that in my career. That when there might not be data behind something, there is power behind qualitative evidence. When you go on the round and then afterwards you hear rumors of, oh wow, the CEO was rounding us, that meant a lot to us. That feedback through the rumor mill generally gets back to the executives, or they'll see it in the surveys, and it makes a difference. So I would say, to answer your question of when there's not quantitative data, if you put into practice what you're talking about, you'll start seeing qualitative nuggets, and that in turn will give positive reinforcement to the executive or to the leader to continue to do what they're doing.
I love that. That's so interesting and such a good point we don't always have to have the entire thing implemented to actually have proof of concept beforehand. The nuggets, I really like that. Thank you.
Yeah, thank you.
Corey?
Well, for me, it just goes back to the core values. If recognition is a part of your core values, and you can tie that to our mission and our purpose, and really go back to the legacy. We've been around for 138 years, and if you look back at the traditions and the history and some of the legacy stories about what made this organization successful, it always goes back to the relationship between the caregiver and the patient. And if you think about recognition and you think about the cultural norms and the tenets and the principles of being a good human being, and this makes sense, and common sense has a lot to do with what we do in HR every day, then you generally can get the support and the commitment you need.
Yeah, I appreciate that. I think something, again, like looking at the framework of recognition and the psychology behind it, I've always really related it to Pavlovian theory. The concept that behaviors that are recognized or rewarded are those that are often repeated, which can be really powerful in as you put it, a very thankless job. My little brother and my sister-in-law are both nurses, and they both recently graduated together. And my little brother, just to paint kind of the picture, right, he's this big, buff, wannabe tough guy, and so called him after, hey, how's nursing going? How's your first full-time gig at a hospital? And just immediate sobs. And my sister-in-law's pregnant right now, doing the same, like pregnant and just on her feet all day, every day. And so the next time I have a tummy ache, at my desk job, I often think about what my nurse family are doing and how impactful the thank you notes, I appreciate what you're doing. I see you working these extremely long hours on your pregnant feet. Like, I see that. So I'm curious, from that perspective, from like understanding the type of employees that we have, from again the very top down to the entry-level positions, what are some programs that you're particularly proud of that you've implemented at your respective or past organizations that proved to be really efficient in not only touching the lives of every single person in the organization, but also had that tangible return that we're talking about? It's kind of a loaded question. Corey, can I start with you?
Sure. It goes back to, as we define value and what's meaningful and what's really inspiring to you, how do we deliver on that? And recognizing that, one person's value may be very different, but the common theme for us is why. Why do you perform? Why do you stay? And why did you come? And if we can identify the answers and continue to deliver on that value proposition, then the premise that if we deliver for you, you're going to deliver for our patients. And it's really that simple.
Yeah, I appreciate that. JD?
Yeah, so at HCA Healthcare, we implemented a group called the Employee Advisory Group. And what it was each different department, from housekeeping to surgical services to robotics, had a representative that attended the forum with HR, and it was an opportunity for us to hear. The executives, I would stay out of the room so they could kind of speak openly, and they'd be able to talk openly about some of the issues that were going on. And what we strove to do was, one, listen, and then two, empower for the things that they could do of, hey, we'd love to have, food trucks on Wednesdays. Cool. Who would like to volunteer to, call around to different vendors and get that organized? There were other things that an executive team would have to step in and see what we could do to help. But really powerful, and I believe would drive data behind turnover, recruitment, because you have happy employees who are telling their friends that they should come here. That drove results. So from listening and empowering to the employees.
Yeah. I recently read an article from the Harvard Business Review that analyzed a couple of different organizations and said that 40% of people that have friends at work are likely to stay 2 or more years at the organization, which, given like the millennial and Gen Z workforce, that's pretty impressive tenure. People don't typically stay unless you're at Youth and Methodist, is what it sounds like. Like, it's pretty impressive. But I want to ask you the same question in tandem with potentially how has Awardco helped streamline some of the processes? So I'll just add that little piece onto the question.
Sure. So one, I would say listening is super important. I think as a leader, I think it's important to understand the difference between like actively listening and just listening, right? Because we have a lot going on and we're trying to juggle conference calls and emails and IMs. But I think it's listening with intention and not listening waiting to respond is super important. Just from a team level, I always try to make sure I'm listening to my team, but I learned very quickly that not all of your employees want to be publicly recognized, so it's really understanding what is their preference. I've had some reach out to me as soon as I've done a Bravo and sent them a Bravo, how awesome they are, why'd you do that? Don't ever do that to me again, right? So we did implement the Awardco Bravo system about a year ago. And what that's done is it's actually transitioned many of our projects and internal initiatives that we have more of a departmental level that were manual before in spreadsheet tracking. I know that sounds so like early 2000s, but especially when you're talking about our exceptional bonus. So we have a certain allotment per department of once you receive your annual bonus and your annual increase, your director or VP can nominate someone special within your team to receive extra funds. So we use the platform, the Bravo Awardco platform, to manage those nominations. So then our comp team can gather that data and be able to make sure that we're awarding the correct person. We don't have the incorrect date of birth, the incorrect EEID. So that's been extremely helpful. One other thing I will mention based on what you were stating, so we have a new CHRO. He's been there, he's a Methodist just about a year. So he arrived a little before I did. He started a step down meeting approach. So what that means is he is going one level below the management level, and he's actually randomly meeting with small groups of like your independent, your individual contributors. So we're not in the room, and it's amazing what he's hearing. And so we're able to compile that information this year and set some initiatives and some goals on based on what's important to them that maybe we weren't aware of as their leader. So I think that's been extremely enlightening.
I love that. Corey, you're kind of nodding your head. Anything
Oh,
you'd
absolutely.
add?
Well, it goes back to BJ's comment about voice and giving people a chance to express themselves in a self environment where that concept of being able to speak the truth to senior executives is part of the culture and is expected. And the idea that you're part of the solution. It's easy to point to a problem and say, we need to fix this, but giving those team members the chance to have that responsibility and that accountability for coming forward with and implementing the solution to some of these areas is really huge. Our advisory groups it's a privilege to serve because you're not a part of a company union, but you are certainly there to represent the interests of your peer group. And every year we have a team member advisory group summit, and we have all of the executives listening for a day and not responding, thinking, processing, and then coming forward with, here's our commitment to change. And that's part of our people strategy every year.
But see, that's the key, is the commitment to change it, not just hearing it, but then actually putting it into place.
So how do you do that? How do you get, again, in your ear 24/7, being the people leaders, we need this to change, we need that to change? Just out of curiosity, how? Like, how do you actually make those changes and implement them?
So we implemented, and I believe this is a best practice across the industry, I'm sure, it's a stoplight report. So basically what that is it's capitalizing on the importance of we're not just listening, we're acting. Yes, we've heard you, this is what we're doing. Green is completed, hey, we've listened, we've completed. Yellow is we're working on it. And then red is, hey, we've listened, and this is why we can't do it. I think that's so critically important. There's some things that we genuinely cannot do. And instead of being afraid or feeling guilty that we can't do them, we need to acknowledge, hey, we actually can't do that, and this is the why behind why we can't do it. So I found personally that those stoplight reports, they hang in each and every one of our departments. And they bring great power because it shows that we're not only listening, but we're acting.
Yeah. Transparency is incredibly
Absolutely.
important in the employee experience. Anything the two of you would add?
I can add a little bit there. So every year we do our employee opinion survey, which I'm sure most of you all do. But we've compiled that data along with the step-down meetings that our CHRO conducted. And then our directors and our CHRO met with our organizational development team to really compile that information to determine, as an overarching HR team, what do we want to accomplish and what does our roadmap look like over the next year, 2 years, 5 years, 10 years, so we have something to visually strive for. So in turn, then we met with at the management level of HR, signed off, tweaked whatever we felt was necessary, and then annually, I attended my first one this year, and it was so awesome. We have a fairly large HR group, and that also includes our employee wellness or organizational development team. So we all met at a centralized location, and everyone was in person for the first time in a long time, and you got to see names and faces and meet each other, and we rolled that out to the broader HR team. So now everyone has the same list of goals and how it looks, and to visualize it amongst the full HR team and then our department. Then we met with our team. In fact, that happened yesterday. It was so sad I didn't get to attend, of what it means for each team. My team versus another manager's team. What does that look like? What do you want to be part of? This is your opportunity to empower yourself, to stretch, to grow, to be part of the change and the movement that we make, instead of it just being us dictating what that's going to look like.
I appreciate that. That's really awesome. Thank you. Again, the multitasking, that's amazing. It's incredible. True skill. Anything from you, Corey?
It goes back to accountability. We hold ourselves accountable to our community and our patients and to our people. So every town hall, every monthly leadership conference, every opportunity we have is full disclosure. Here's our dashboard. And the dashboard talks about the progress we're making or not making and why. And explaining our success or failures and our key learnings, and really engaging the audience, which is all of our team members. What can we have done differently? We do an annual HR stakeholder analysis, and that's really, are we improving the quality of your experience as a team member? And where do we have opportunities for improvement? And what can you do collectively to help us get there?
Appreciate that. Something that I'm curious about, and potentially others in this room, I love sharing, getting new ideas of what other people are doing in the industry to potentially implement later this year. So I would love to know a little bit about your individual roadmaps. And JD, maybe some of the things that your team are considering as exciting movements in the industry. But what are we focusing on in terms of employee well-being and recognition, employee engagement? What are some of the things that we're hoping to implement this year? Corey, I'll start with you.
There's a lot out there.
It's okay, we want to hear it.
So, some of the things that we're trying to do is really think about what are the 4 strategic pillars that make up your definition of value. So leadership, quality, career advancement, culture values that resonate with a multi-generational workforce, and then total rewards that are not just trying to compete with the 5 larger healthcare systems in Cincinnati, but really thinking about how do we drive intrinsic job satisfaction? How do we think differently about building incentive compensation programs where individuals have more impact over their total cash compensation, and really doing some things that are unique in terms of thinking differently about defining success from an employee perspective. So it's repackaging that commitment that we're making.
Yeah, thank you. JD, what's on your roadmap?
Yeah, so I think it's incredibly important to stay in tune with the different trends that are going on. And we know budgetarily at times we are constricted. So being creative is really important. One thing that I know my hospital, Olympic Hospital, that we were focusing on just when I left was the importance of recognizing the hard work that our director levels do. And they often don't get paid for overtime. there's different bonus structures and things like that. But what can we do other than a financial boost to help them get recognized? So something that we had implemented and would try to re-implement in myself with my 11 different direct reports that I focused on was having them get off every other Friday. To have that next level leader, somebody that they could pass things off to, they could know the ship would keep on running, surgeries would keep on going, rooms would keep on getting cleaned, but they could take some time off. So I think that does a couple things. One, physiologically it gives them some rest. And then secondly, it helps them see, oh wow, my partner, or boss, but partner, truly feels that I do work my tail off, and they want me to take time with my family. They want me to have time with my loved one, my significant other, because myself, we recognize that when they're whole and their families are whole, they're so much more effective at work, and ultimately, they're much more effective with the patient.
Yeah, that's incredible. I love that. Work-life balance as much as we can. Thank you. Danita.
Well, I think I've mentioned several of these already, but long-term strategy, really going to focus on the results of this survey. Because we don't want to invest our money in something that may not be important to the majority of our population. But I think I have a little bit of a different perspective because I'm more on the health and welfare and the benefits overarching, which is a large, cost driver. So we have a few things that we're working on. One, we have new systems going in. I have team members. We're losing some of our tenured subject matter experts to this project. So we're running fairly thin, but on top of what I've already mentioned, I think from a health and welfare perspective, we're trying to balance the health and well-being of our colleagues and our employees, but also the cost. And so I don't know how many of you are benefit people in here, but for us, where we're spending a lot of our time is where we're forced to spend our time. And that's with the drivers of GLP-1s and things like that. So we have a lot of internal strategies, ACO strategies as a whole, what we can take to the marketplace, what that, with our expertise. And then secondly, where can we build internal programs where we're not just totally eliminating prescriptions and medications that are pivotal to their health, but how can we leverage the departments and the talent we have internally and the resources we have that maybe, an oil and gas company may not. We have a wellness and a weight management team, a bariatric team. So starting to incorporate programs to be able to utilize some of these medications that have great health benefits, but a change of lifestyle too, to monitor where they are with their diabetic journey or their weight management journey. So in order to get GLP-1s, you have to participate in our BMI program, and you have to attend classes every month. And the whole idea is not to have people relying on medication, but relying on themselves and bettering themselves. And if they can better themselves, that's a better mental, physical, emotional outcome. We've done our job and also saved some money to the plan. So.
And what a great way to personalize a very widespread company strategy. I think that's something I hear often is, well, we still want to make sure that it's personal.
Yep.
When we talk about implementing formal recognition systems, it has to be personal still. And what a great way to actually say, no, it's efficient and personal. There's still that level of that personal touch. I'm curious, maybe to piggyback off of some of the things that you said, given all these great initiatives that you have this year, being a current client of Awardco, how are some of the ways that you're leveraging Awardco to potentially help with some of that administrative burden that can come with big initiatives like this?
So we are moving to a systemness approach. I'm sure you all are using that term in some form or fashion. I'm excited about it. I have been in numerous organizations where we've moved to that approach instead of being siloed. So with that, I've been working with our HR management team to come up with strategies that we can combine. We have, I believe, 8 hospitals currently, and we're opening another one. So we have one strategy. So we have Caught in the Act, which I'm sure you all have things that are similar. It's really recognizing people who are caught in the act of doing something above and beyond their day-to-day functionality, employee recognition for Employee of the Month, also looking to hopefully maybe incorporate Stop the Line, and I'm sure you all are used to that too. But we've had this we do it at the Woodlands, or we do it this way at our Katy location, or we do it this way at HMH, because HMH is our largest medical center downtown. So coming to the mindset of, okay, let's figure out a way, instead of using my one person to create all of these individual Bravo experiences, let's all have a conversation together, and let's see where we can go and bring this into more of a universal approach, universal messaging from our CEO, and then some of the sites that aren't doing it at all now have an opportunity to have something that's almost plug and play. So our team here has been very helpful with that. The one thing I would say, feedback from my team, I wasn't here when we implemented the Awardco platform, was taking our creative ideas and be able to put them into work. I have worked with many vendors that it's in a box. This is what we have, we can't do that. Our team here has not come back to us and said we can't. It's like, well, what do we need to do to get there? So we appreciate that partnership, and I think it's being recognized amongst our system, and which is building more recognition, more initiatives, and just an overall system approach to where we're working together for a good outcome.
That's fantastic. Great feedback. Good job.
Good job, Denver.
Good job, you guys. Not surprising if anybody else has worked with Denver. He's pretty phenomenal. I really appreciate that. Corey, kind of turning to you, going back on everything you've talked about with bringing everything back to core values, wanting to make sure that nobody feels siloed, that it is this universal approach. How are you guys currently doing that today? Your comment kind of inspired me when you said some locations that don't do anything. And man, that is so true, especially when you have different organizations in several different places where you might have one leader there that's extremely ambitious and will do something like this on his or her own, and then you have others that maybe don't see it as being as important. How are you today helping it be as equitable as possible among all of your departments and locations?
Well, I think the key for us is really about creating access and awareness and raising the organization's consciousness that this really is a great place to be, but if we don't communicate effectively, and if we don't have a platform for change and help people look forward, we're missing out. So our goal is to really create a team member experience platform which takes into account every facet of what's good about this place. Everything from the 4 tenets of our value proposition to what about our wellness and well-being strategy, and what about that career counselor I heard about, and how do I advance professionally, personally, in terms of my own development. So it's really a source of anything and everything that's good about this organization, where team members can have easy access to everything about our DEI&B initiative, everything regarding the long-term strategy around total rewards. So it's a source of knowledge and information, but it's a one-stop shopping around the team member value proposition. So that's our goal going forward.
Appreciate that. As we're nearing the end, I want to talk about the large, the picture, where you envision recognition specifically in the healthcare industry going, the ways that it's going to be effective at your respective organizations. And JD, I'm going to start with you. We've kind of alluded, again, he's in a little bit of a different role now, stepping away from administrative healthcare leadership and now in a consultative role, doing what he loves most, which is spreading the good word of culture.
That's right.
So talk to me about, what makes you feel really hopeful about the concept of employee recognition and healthcare, and where is it going to go?
Yeah, I think what makes me hopeful is the more data that we do get, quantitative data, I think the more people will buy in to it, because the fruits are in the labor. I think people will start catching on and recognizing the power of positive reinforcement, of recognizing not only in teams, but in their personal lives, in their families, because it truly does change people, and it's such a much more healthier way than just calling out people's negatives, but focusing on their strengths, calling them out when they do good things, the good catch programs. There's so much great power that builds a culture, and that's why I'm so excited about my current role of my ability to spread that good news on a worldwide scale. That recognizing people does build a healthy culture and does drive results, quality, financial, and I personally feel and believe that as we embrace the power of recognition, we will see those results both on a small and large scale.
Thank you. Go to Corey. I'm going to end with you, Danita. Ladies last, potentially.
Fine with that.
First and last.
You know, I think it brings back what Mayo Clinic was trying to do around the practice of medicine and bringing joy to medicine. And for us, it's joy at work. What's this joy mean? What can we do, given the commitment, the dedication, the loyalty? What can we do to create more joy for you as an individual, as a member of this organization? So thinking about that and constantly thinking policies, procedures, practices, anything we can do that would ultimately impact your quality of the experience is really our key objective.
Yeah. Thank you. Ms. Danita.
Yeah, sure. So one of the questions on our Total Rewards survey is, how do you prefer to be recognized? So that way we can really understand, okay, before we roll out like this massive points program where, you know, you can get an Amazon card, whatever, which is great. I have been in places that use that, and believe me, everyone loves to get their Amazon card. But do you prefer a note from your manager? Do you prefer, you know, to be recognized in a meeting? Whatever that looks like to them. So that's one. Another area we're looking at is with AI, and we talked about a little bit earlier, and we have some other areas of that topic later, is understanding that we need to repurpose some of our workforce, and how can we do that? So we're looking at a program to be able to provide certification for some of our staff that may be looking to get to the next level, some sort of like a medical assistant or, you know, a nurse practitioner. How can we get them from one certification to another and invest in them on behalf of Houston Methodist? So we are keeping that talent and that tenure rolling, and we've already invested in them at this point, so we don't want to lose them to AI or improvements, but we want to repurpose their talent.
Thank you. Thank you all so much for sharing everything that you did today. A slogan that Awardco has recently implemented that I really love, I'm not sure where we picked up on it, but I think it's here to stay, which is we need to create a culture by design, or you get one by default. And that's unfortunate because sometimes we can't always choose the default, but the good news is that the world of recognition is becoming bigger every single day, and due to people like you who actually care about this stuff and understand the importance behind implementing something like this that has these positive business effects. I think some of the big key takeaways that I also learned from each of you is that recognition it can be a big undertaking, but the good news is that it's not singularly an HR initiative. You've talked about data, you've talked about implementing important things, and that is implementing and having the entire company be a part of something great. And when the whole company is on one page, you're going to have all of the great returns that we talked about. And so you're not in it alone. You have culture builders in all different parts of your organization, but it all starts with you, our leaders. And thank you so much for taking the interest that you have in your people and understanding more about recognition. Thank you for spending time with us today. Thank you all so much.
Thank you. Thank you.